Could a computer program, like, actually read your mammogram just as safely as two highly trained doctors looking at it? It sounds a bit like science fiction, maybe, but that's really the question at the heart of a fascinating new study we're diving into today.
Yeah, it's pretty groundbreaking stuff, really.
We're looking closely at research investigating AI in mammography screening.
Hmm.
Is it safe? Is it effective?
Hmm.
And our goal here is to unpack what this study tells us about AI's potential in healthcare
Yeah.
and really what it could mean for you down the line.
And what makes this study, the ANG-SII trial, stand out is, well, its design and scale. We've seen AI look promising in retrospective studies before, looking back at old images.
Looking at past data.
Exactly. But this one, published in the Lancet Oncology, is different. It's a large, randomized controlled trial comparing AI head-to-head with the current standard practice in real time.
Okay, so let's back up a bit. Why even look at AI for this? I mean, what's the problem with the way mammograms are read now?
Well, the standard approach involves two radiologists independently reading each mammogram. It works, but honestly, it creates a huge workload.
I can imagine double the eyes means double the reading time, basically.
Pretty much. And there's always that drive, to get even better at finding cancers earlier and more accurately. So AI is seen as a potential tool to maybe help with both the workload and possibly detection.
Okay, that makes sense. So how did this AMSI trial actually test the AI? What was the setup?
So it was a randomized controlled trial run across 4 screening sites in Sweden. They enrolled, get this, over 80,000 women aged 40 to 80.
Wow, 80,000. That's a lot of participants.
It really is. This was between April 2021 and July 2022. These women were eligible for screening and hadn't opted out. They were then randomly put into one of 2 groups.
Okay, what were the groups?
One group received AI-supported screening, that's the intervention. The other group had the standard double reading by 2 radiologists, which served as the control group.
And the radiologists reading the scans, did they know which group a scan came from?
No, they were blinded, meaning they didn't know if a specific scan was part of the AI group or the standard group. They knew they were in a study, of course, but not the allocation for each case.
Okay, interesting. So in the AI group, what exactly did the AI do? Was it making the final diagnosis?
Not exactly making the final call, no. The AI system they use, called Transpara, basically analyzes the mammogram images using deep learning. It looks for patterns that might suggest cancer.
Uh-huh.
Then it gives each scan a risk score from 1 to 10, and that score was used for triage.
Triage. How so?
Well, if the AI score was 1 through 9, that scan went to just one radiologist for review. But if the score was 10, the highest risk, it still got the standard double reading by 2 radiologists.
Ah, okay. So a sort of safety net for the highest risk cases.
Exactly. And crucially, for all the cases in the AI group, the radiologists had access to the AI score and could see any areas the AI had flagged as suspicious.
Right, so it's AI support, not AI replacement.
Precisely. It's decision support.
Okay, so this is the core of it. What happened? What did they find when they compared the AI group to the standard group? This was the initial safety check, right?
Yes, this was the pre-planned safety analysis after the 80,000 women were enrolled. And the findings were, well, quite compelling. Let's talk cancer detection rates first.
Okay.
In the AI-supported group, the rate was 6.1 cancers detected per 1,000 women screened.
6.1 per 1,000. And the standard group.
That was 5.1 cancers per 1,000 women screened.
So higher in the AI group, noticeably higher.
Numerically higher, yes. The ratio was 1.2. But statistically speaking, the p-value was 0.052. So it was right on the edge of what researchers usually call statistically significant.
Meaning it's a strong trend, but you can't completely rule out chance just yet.
Kind of, yeah. There's a trend suggesting AI might detect more, but it didn't quite cross that statistical significance threshold of 0.05 they often use. Importantly, though, the detection rate in the AI group, that 6.1 per 1,000, was comfortably above the safety baseline they'd set beforehand, which was 3 per 1,000.
Okay, so it met the safety criteria. What about callbacks? Like, how often were women asked to come back for more tests?
The recall rates were actually very similar. It was 2.2% in the AI group and 2.0% in the standard group. Pretty close.
And false positives. Scares that turn out to be nothing.
Also very similar. The false positive rate was 1.5% in both groups. No difference there.
Okay, so similar recalls, similar false alarms. But what about when someone was called back? Was the AI group more likely to actually have cancer found?
Yes, that's the positive predictive value, or PPV. And it was higher in the AI group. It was 28.3% compared to 24.8% in the standard group.
So a callback in the AI group was a bit more likely to be for an actual cancer.
That's what the data suggests, yeah.
Did the type of cancer differ? Like more invasive versus less invasive, the in situ cancers?
There was a slight difference reported. In the AI group, about 75% of the cancers found were invasive, 25% were in situ. In the standard group, it was slightly more invasive, 81% invasive and 19% in situ.
Interesting. Now, you mentioned workload earlier. That seems like a huge potential win here. What did the study find about that?
Oh, absolutely. This was one of the really striking results. They found a 44.3% reduction in the screen reading workload for the radiologists in the AI-supported group.
Wow, nearly cut in half.
Yeah, almost half. That's a massive difference. Think about what that means for freeing up radiologist time, potentially reducing burnout, maybe making screening programs more efficient overall.
That's huge. So putting it all together then, what's the main takeaway from this initial safety report?
Well, the key message seems to be that based on this interim analysis, AI-supported mammography screening looks safe. It achieved a similar cancer detection rate to the standard double reading, maybe even slightly higher, though not statistically significant yet. And importantly, it did this while drastically cutting the radiologist's reading workload.
And the trial wasn't stopped for safety reasons or anything?
No, not at all. The safety analysis showed it met the criteria to continue. And it is continuing. They're following up all the participants, actually aiming for 100,000 women enrolled in total to look at the primary outcome, which is the rate of interval cancers. Those are cancers detected between the scheduled screening rounds, usually after 2 years. It's often considered a key measure of screening effectiveness.
Got it. So more data to come on that front. And who actually funded this large study?
It was supported by several groups.
Yeah.
The Swedish Cancer Society, the Confederation of Regional Cancer Centers in Sweden, and also Swedish governmental funding for clinical research known as ALF.
Okay. Thinking about this really connects back to our recent deep dive on trusting AI responses, doesn't it?
It really does.
It just brings up more questions about, where and how we should be integrating this kind of technology into really critical areas like healthcare.
Absolutely. And if you found this interesting, you might want to check out that previous deep dive we did, Would You Trust an AI Response? It looks at the trust angle from a different perspective.
Yeah, definitely worth a listen. So considering these results from mammography, it really makes you wonder, where else in medicine could AI play a similar role? What other screening or diagnostic areas might benefit? And maybe more importantly, what are the really crucial factors we need to nail down as we think about bringing AI into these fields? Definitely gives you a lot to chew on.